This is Ed Kernick from the Department of Cell Biology and Physiology at the UNC School of Medicine. This is a pre-lab module for the respiratory anatomy demonstration during the respiratory block. The goal of this pre-lab module is to help familiarize yourself with the anatomy of the upper respiratory system. During the upper respiratory anatomy demonstration, we'll review some of the major bones of the skull. We'll consider the frontal bone, which forms the forehead and a portion of the orbit, the paired nasal bones that form the bridge of the nose, the zygomatic or cheekbones, which also contribute to the orbit, and the large maxilla. The maxilla also contributes to the floor of the orbit and surrounds much of the nasal cavity. The maxilla houses our upper dentition. We'll also consider the mandible. The mandible, the lower jaw, houses our lower dentition. In the upper respiratory anatomy demonstration, we'll consider the bones that surround the nasal cavity, mainly the maxilla. Note the opening in the maxilla into the nasal cavity. This pear-shaped opening is referred to as the piriform aperture. If I enlarge this area, we can peer inside the nasal cavity, and one can appreciate the midline, bony nasal septum, and the lateral walls of the nasal cavity, with these bony scroll-like elevations referred to as the bony conchae. We'll talk more about these bony elevations in a few minutes. In the upper respiratory anatomy demonstration, we'll also consider the paranasal sinus system. Many of the bones in the anterior aspect of the skull are in fact hollow. Areas of the frontal, the maxilla, and the ethmoid, as well as the deeper position sphenoid bone, have hollow areas. These form the paranasal sinuses. In this cartoon representation, one can appreciate a hollow area within the frontal bone that forms the frontal sinus, the large hollow areas in the maxilla, the maxillary sinuses. Along the medial side of the orbit, the ethmoid sinuses, often referred to as the ethmoid air cells, and then deeper within the skull, a hollow area within the sphenoid bone called the sphenoid sinus. These paranasal sinuses have important functions. They help to reduce the weight of the skull, they help alter or change the resonance of our voice, and they serve important immunologic functions. If one would take a coronal or frontal section through the head, you can convince yourself of the location and size of these paranasal sinuses. Note the midline nasal septum and the lateral walls of the nasal cavity, and note in the frontal bone the location of the frontal sinus, in the maxilla the large maxillary sinuses, and along the medial side of the orbit the ethmoid sinus or ethmoid air cells. All these paranasal sinuses drain their secretions into the nasal cavity. One can appreciate these sinuses in an X-ray. Note the frontal sinuses, the ethmoid air cells, and the large maxillary sinuses within the maxilla. Also in the upper respiratory anatomy demonstration, we'll consider the anatomy of the nasal cavity and the pharynx. This is best appreciated by studying a sagittal section. If we could cut through the head sagittally and look in from the side, we can study the nasal cavity and pharynx in great detail. In the upper respiratory anatomy demonstration, we'll consider a midline sagittal section of the head. Let's take a moment and orient to this section. Anteriorly, the nose. Note the location of the tongue and the oral cavity, the roof of the mouth, the hard and soft palate. Note the midline nasal septum and the location of some of the paranasal sinuses, the frontal and sphenoid sinus. In this image, also appreciate the location of the cervical spine and the vertebral canal where the spinal cord rests. The pharynx is a fibromuscular tube that extends from the base of the skull to the inferior aspect of the cricoid cartilage. Our pharynx serves to transmit air from the nasal cavity down into the larynx and trachea, and food from the oral cavity down into the esophagus. The pharynx is divided into three parts. Superiorly, the nasopharynx, posterior to the oral cavity, the oropharynx, and posterior to the larynx, the laryngo, or more often referred to as the hypopharynx. Let's study the nasal cavity and the nasopharynx in more detail. In this enlarged view of the nasal cavity and nasopharynx, we can appreciate the important anatomy. Again, note the location of the roof of the mouth or the hard palate, the soft palate, the sphenoid sinus, and the frontal sinus. Note the midline nasal septum. If I could take a scalpel and cut along the nasal septum like this and reflect it, one could appreciate the lateral wall of the nasal cavity, seen here. Note these bony, scroll-like elevations, the conchae, and note that they're covered with mucosa. Clinicians generally refer to these conchae as the turbinates, the superior, the middle, and inferior turbinates that lie along the lateral wall of the nasal cavity. These turbinates serve to warm and humidify the air as we breathe. Note that the turbinates have small little recesses or spaces beneath them. The paranasal sinuses drain their secretions into these recesses or meatuses. The majority of the secretions occur beneath the middle turbinate in the middle meatus. Let's continue to study the nasal cavity and the nasopharynx region. Note that in the superior portion of the nasopharynx is the pharyngeal tonsil, often referred to as the adenoid. Note the opening along the lateral aspect of the nasopharynx is the eustachian tube, or sometimes referred to as the pharyngotympanic tube. This eustachian or pharyngotympanic tube connects the nasopharynx with the middle ear cavity and serves as a way to equalize the pressure between the middle ear and our nasopharynx. If I could remove some of the tissues here, we could better appreciate the eustachian tube and how it connects to the middle ear cavity. Note the eustachian tube connecting to the middle ear and the nasopharynx. The patency of this tube is opened by two important muscles. These muscles help to elevate our soft palate. These are the tensor veli palatini and the levator veli palatini. Contraction of these muscles helps to open these tubes. One can appreciate the eustachian tubes connecting to the middle ear and these small muscles of the palate, the tensor and the levator veli palatini. During the respiratory anatomy demonstration, we'll also consider the important innervation to the nasal cavity. Note all the nerves and blood vessels located within the mucosa in the nasal cavity. Located superiorly is where cranial nerve number 1 axons, the olfactory nerves, reside. The nasal cavity can be divided into an anterior 1/3 and a posterior 2/3. Note that the anterior 1/3 of the nasal cavity gets its sensory innervation from the first major branch of the trigeminal, called V1, or the ophthalmic division of the trigeminal. The posterior 2/3, outlined here in green, receives its sensory innervation from the second major branch of the trigeminal, V2, or the maxillary division. In the demonstration, we'll also consider the vascular supply to the nasal cavity. Much of the vascular supply to the nasal cavity enters through the sphenopalatine foramen via the sphenopalatine artery and its branches that help to vascularize the nasal cavity. The sphenopalatine artery is a terminal branch of the maxillary artery. Also in the upper respiratory anatomy demonstration, we'll consider the anatomy of the larynx. Remember that the pharynx is a fibromuscular tube that extends from the base of the skull to the inferior aspect of the cricoid cartilage. Remember this pharynx is divided into three parts: a nasopharynx, an oropharynx, and a laryngo or hypopharynx. The muscles that form the pharynx are referred to as the pharyngeal constrictors and can be appreciated in this sagittal section. In the anatomy demonstration, we'll consider in detail the anatomy of the larynx. If we enlarge this larynx, one can appreciate the location of the epiglottis, the base of the tongue, and the laryngo or hypopharynx. As we enlarge the larynx, note the location of the epiglottis and the location of the vocal fold. This is the true vocal cord. Located just superior to the true vocal cord, or the vocal fold, is the false vocal cord, often referred to as the vestibular fold. There is a space between these two folds called the ventricle. Clinicians often describe areas above the vestibular fold as the supraglottic space, and this area of the larynx below the true vocal cord, or vocal fold, as the infraglottic space. Supraglottic, ventricle, and infraglottic space. As a clinician, you won't view the larynx like this. You'll use a mirror and look at the larynx like this. Looking down through, one can appreciate epiglottis and the true vocal cords, or the vocal folds, and the vestibular folds, located superiorly, or the false vocal cords. In the upper respiratory anatomy demonstration, we'll consider the laryngeal skeleton as well. If we could enlarge this area here, one can appreciate the skeleton of the larynx. Note the hyoid bone, the large thyroid cartilage, the cricoid cartilage, and the epiglottis. Note the membrane between the hyoid and thyroid cartilage is called the thyrohyoid membrane. Let's turn and look at the posterior aspect of the larynx. Again, note the large epiglottis, the cricoid cartilage, and the posterior surface of the thyroid cartilage. In all of us, the laryngeal skeleton is actually draped with muscles and membranes and appears more like this. Note the epiglottis, some of the intrinsic muscles of the larynx, like the transverse and posterior cricoarytenoid muscles. Again, as a clinician, you won't visualize the larynx like this. You'll look down into the larynx and appreciate the vocal folds, or the true vocal cords, the false vocal cords, or the vestibular folds, and the epiglottis and the tongue base. And finally, in the upper respiratory anatomy demonstration, we'll review the important innervation to the larynx. Note that the entire larynx is innervated by the vagus nerves. Seen here, the right and left vagus nerves. They supply all the sensory and motor innervation to the larynx. Note that each vagus nerve gives rise to two branches that innervate the larynx, the superior laryngeal nerve and a recurrent laryngeal nerve, superior and recurrent. The superior laryngeal nerves divide into two branches, an internal branch and an external branch. The external branches innervate the cricothyroid muscles, where the internal branches go through the thyrohyoid membrane and provide the sensory innervation inside the larynx above the vocal cords. These small little internal branches of the superior laryngeal nerve of the vagus are very important. The recurrent branches on the left side recur underneath the arch of the aorta, and on the right side typically recur underneath the subclavian artery, and ultimately innervate the majority of the intrinsic muscles of the larynx and the mucous membranes below the vocal cords. The superior laryngeal nerve, with its internal branch and external branch to the cricothyroid, and the recurrent laryngeal nerves that innervate the majority of the intrinsic muscles of the larynx and the mucosa below the vocal cords. This is the end of the upper respiratory system anatomy lab demonstration pre-lab module. I hope you find this module helpful in preparation for the anatomy demonstration. There are some self-assessment slides to follow for those that are interested. Let's consider a self-assessment so that you can check your understanding. Identify the structures marked A, B, and C. If you answered A is the superior, B is the middle, and C is the inferior turbinate, then you are correct. Let's consider another self-assessment so that you can check your understanding. Identify the structure or opening at the tip of the arrow. If you answered eustachian tube or pharyngotympanic tube, then you are correct. Remember that the eustachian or pharyngotympanic tube connects the nasopharynx with the middle ear cavity and helps us equalize pressure. Let's consider another self-assessment so that you can check your understanding. Which cranial nerve provides sensory innervation to the area marked A and the area marked by B? If you answered A is innervated by the first branch of the trigeminal, or V1, then you are correct. If you answered area B is innervated by V2, or the second major branch of the trigeminal, then you are correct. Let's consider another self-assessment so you can check your understanding. Which letter, A or B, represents the true vocal cord? If you answered B, the vocal fold or true vocal cord, then you are correct. A is the false or vestibular fold. And let's do one final self-assessment so that you can check your understanding. Which nerve provides sensory innervation inside the larynx above the vocal cords? Is it A, B, C, or D? If you answered A, the internal branch of the superior laryngeal nerve of the vagus, then you are correct. B is the external branch, which innervates the cricothyroid muscle, and C and D are the recurrent laryngeal nerves. The recurrents provide the majority of the motor innervation to the muscles of the larynx and innervate the mucous membranes in the larynx below the vocal cords.